This is Hashtag Finance, presented to you by the Canadian Securities Exchange, the exchange for entrepreneurs. With your host, Barrington Miller.
Hi, welcome to an edition of Hashtag Finance. I'm your host, Barrington Miller, Director of Listed Company Services at the Canadian Securities Exchange. Today, I'm here with Mr. Brad Moore, CEO of Global Cannabis Applications Corp. How are you doing today?
I'm good, Barrington. How are you?
I'm good. We are broadcasting from the second floor of my house. Usually it's the 72nd floor at First Canadian Place, but we haven't been doing that for a while. We are taking it live on Zoom. So tell us how you're doing. How's the family? How is COVID treating you?
They're good. Yeah, it's been crazy. For me and my team personally, we all work remotely because I got a bunch of people in Israel. I got people in Lithuania. I got somebody in Spain. I got somebody in Montreal. The CFO and some of my market people are in Vancouver. So we're used to working out of the house, especially I've got this weird work day, right, that starts at like 8 p.m. and goes to 1 a.m. And then I get up for the markets and then that goes till 2. And then so everybody else this afternoon is my evening. Right. And so I've got this, so for a lot of us, it hasn't really been that much different. You know what I mean? Because I was Zooming before Zooming was cool. Let's just put it that way. Right. And so it hasn't been that. Of
course you invested in Zoom and bought a Rocket shares and.
Yeah. Well, yeah. Right. So that's why I don't have to raise money for the company. I just keep rolling that and my Tesla stock, of course. Right.
Of course.
Which I was out of a while ago, unfortunately. For the family, it's been weird. The kids live in Montreal, and so I see them every week and a half, or sorry, every like a maximum of like 4 weeks gap, right?
Right.
So all of a sudden I didn't see him for 4.5, 5 months, and tragically their grandfather actually passed from COVID. It was just heartbreaking. He was a senior. Yeah, it was just. It's surreal because we all feel the impact of it in our work lives in this, and we watch the news, and then, somebody who gets it, and it really does bring it home. But they're much better. My son, we were able to kind of, do a search and rescue, get him out of Montreal, get him to the more temperate West Coast, where it's like he's not melting like a stick of butter, and on a daily basis. And so we're trying to enjoy a little bit of time together and go through all this. So, but thank you for asking.
No problem. So your company.
Yes.
Tell us a little bit about what your company is doing.
Sure. Well, it's a, you and I have talked, and I've talked about this to a lot of people. It's a big story, right? It's a very big project, and I think it's a big project because if cannabis if it was what it could be, there wouldn't be a need for us. We're really about efficacy, right? Look, the first step is getting it out of the ground, and the last step is getting somebody to use it in an efficient, safe manner. And we know where it's hit its stumbling blocks, just from not even about evaluation, but from growing and exportation, importation, and getting doctors and patients comfortable with it. Our focus is not the 1% of the 1% who are using it, who are getting it advice from their bud tender. It's about growing it to 2% of 1%, 3%, 4% of 1%. And that means we need data. And so we're essentially a data company. We're a medical cannabis data company. In that spectrum, CBD is in there too, because it's a function of the, let's say, the cannabis family per se.
Right.
But that's what we are, is we're a data company. And we're an efficacy, instead of just being like aggregating clinical study information, we're an efficacy data company, and we do that through smart technologies, biometrics, blockchain, AI, all the cool buzzwords.
Yeah,
but
that's
really,
what I was thinking.
Right. Yeah. And it's a conversation I've had a lot, but we've built a world-class system using some really smart guys, primarily out of Israel, who have been leaders in medical cannabis research and development of it as an actual medicinal product. Right. So that's what we do.
let's take one step back. Tell us about you.
About me.
Yeah, like, you know, uh, just a reminder.
Uh-oh.
This is a
Uh-oh.
family.
Is
This is a
it?
family show.
Okay.
So, like, how did you get here? And even further back, how did Fundamental become Global Cannabis?
Yeah, so I got hired into it. I was chief revenue officer at a fintech company in Vancouver. Um, when I moved back to Vancouver from Montreal in 2014, I was at a fintech company, and then I'm much more entrepreneurial by nature. I like a challenge. I'm an ex-army guy, so if there's a challenge, if the wall's high, I'm all perfect.
Yeah,
It's not if I get over it, I'm all like, how do you make it higher, right?
Yeah.
And if I can't do that, I'll get a charge and blow up the wall and go through it. Like it's just everything is just an opportunity. It's not necessarily an obstacle. And when I took over Fundamental, I was recommended, and I met some of the people on the board, and they said, "We think you could help us." We were kind of doing this whole student buy sell thing, and I said, "Well, that's interesting." I said, "What's really interesting is you have a publicly traded vehicle, and you're in the app game, which is good." I said, "My sense is that Facebook is going to do something, which they did with their marketplace." And at the time, I was an investor, I had owned shares in cannabis. And I would, like a lot of people, was enjoying the upside to, if you owned a license and a piece of land, you're a $10 million company, right?
To start.
Yeah, to start, right? And so when I looked at it, my thing was I go, well, look, and I remember looking at a clinical study one day, and I go, this won't work for cannabis. It won't work. You can't do an approval process, and it's very simple. And I've talked about this, a lot of people, you and I talked about this. It's a plant.
Yeah.
So what you test in a gram, there's no guarantee it's going to be the next gram that somebody in that study group tests is going to be the same. Even if it's cloned or it's genetically reproduced, it's an individual living unique organism. And then you have a human body organism. So how do you get average-based efficacy? That was the thing. And so that started a journey. And it started a lot of conversations. And I realized that we could do it, but we're going to have to come at it from the other side. It was going to be about big data, right? And so it started conversations, believe it or not, with people in Lithuania about blockchain. And then I went to Australia, and then I ended up talking to Israelis, which I knew from many moons ago when I used to work at Kodak. And so you know what, honestly, I looked at the Israeli model and I said, how do I commercialize this? How do I make it bigger, right? How do I make the sampling sizes bigger? How do I get there? And what does that look like? And that's really what started it. And that actually, honestly, so that was kind of like, we changed names around, May-ish 2017 with just I hate to say this, but just a glimpse of a vision. And we're all like, because we're not going to do anything if we don't
Sometimes that's all you need, though.
Well, apparently, if you're growing it, that's all you need is a glimpse of a vision. So I figure, why can't I? But yeah, so we did it, and then we did a lot of research. We spent a lot of time, talking to really smart PhDs and doctors and scientists, and actually clinical practitioners, doctors that were treating patients. And that's very important, because when you look at somebody's experience, you have to look at the totality of their experience with any medicine. And if you can't determine that in a clinical study, you have to look at it on a per user basis.
Right.
And so that started it. 2019, we came up with the development plan. We came up with the end game. And 2019 or 2017, the end of it, we started to fundraise.
Let's delve into that. Let's delve into that time frame.
Sure.
End of year 2017 to 2019. I think it's safe to say, and the opinions expressed on this show are purely my own.
Right.
Those don't necessarily reflect those of the CSE. Valuations were kind of nutty.
Yeah.
They were, in some cases, absurd. No basis, and we saw a massive run-up. And there are companies that maybe deserved it. I think a lot of companies didn't, and a lot of companies got swept up in the updraft. But like any coin, there's two sides. and companies companies tumbled.
Well, yeah, 100%. And when you're small cap, it's kind of like a minnow. The tide goes in, the tide goes out. You're not strong enough to swim out. You just float along, and hopefully, as your business develops, you get a little pair of fins, and you can
Right.
mitigate some of that. But we definitely got caught up in that at the beginning, and because we had some buzzwords, really.
Yep.
And our development cycle kind of started, but I remember that fateful morning, January 3rd, and my phone, I was like lying in bed and I looked over and my phone was like flashing like a Christmas tree. I'm pretty sure Christmas is over, and it was like, "Are you watching this?" And I was like, "What?" And it's like, it was like, what, we haven't said anything. And this is my first gig as a Pubco CEO, so I'm very grounded in reality. And I think as an ex-Army guy who's been many different places, I'm all like, okay. I was like, okay, that's interesting, and I'm all like, but every time you hike up a hill, you get to enjoy or unenjoy the other, the downside, right? And so, yeah, I agree with you. I think my sense is, and it's just my opinion, that it would have been made very clear by the existing government regime that they were going to go recreational. So if you were trying to, you're serving cannabis in the Canadian gray market, right? It's not even legal per se, and so everybody's piling in, and then the language comes out that we're going to go recreational. So now it's not even about medicinal, right? It's
Right.
kind of it's like okay, rum is really good for a cough or a cold, right? But now we're just going to sell in the liquor store and everybody can have it. Prohibition's over. And so I wonder how much of that market stuff was just predicated on the fact that they thought the market was just, was going to blow open, right? And then when it didn't shake out, like dun 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 dun.
Well,
But as a true medical company, right?
right.
It's never really, I hate to say it, it's never really been that much about the Canadian market, right? It's been about Europe. It's about places heavily regulated, where there's not a lot of movement forward because of the regulations, and that's what we want to focus on.
Well, we were always talking. We did a special 520, so that was in May instead of 420, and we featured a bunch of cannabis companies. Check it out on CSE_TV on YouTube. And 2020 is the year of the balance sheet. 2020 is what do you really have? What are you really doing? And I think we've seen some of the companies definitely emerged, some of the multi-state operators, again in the US. But there were a lot of companies that are now sort of struggling, trying to find their way because they may not have had as strong a business plan as before.
100%, right? And it's like I said, look, I think 2020 is the year of the delayed balance sheet because of COVID, right? So
Right.
we've all kind of had to adjust. I knew that look, we were coming out the gate nice strong in the alignment, and it was literally March. We're like, okay, we're going to come out and we'll have this in place, and then it's the building blocks started getting chunked away. So for us as a company, said, look, we're small cap. We got to work with what we got to look. Nobody's given up, and nobody died from eating crap dinner for the last 6 months. So that's fine. So we just knuckled down and we worked on those strategic partnerships. One of the things when I look at our business development in 2018 and how much stuff we built and all the good news, and then we came out and we determined in 2019 as things were kind of crumbling apart a little bit, I think in the net overall market and getting swept up in that.
Yep.
Is that we saw a couple of key things, and it was that the EU said we need to decriminalize this, we need to take it off Schedule 1. And then there was the but we need this information, this information, this information, this information. This is where you saw the explosion of the seed to sale companies, right?
Right.
The regulatory guys that could get you through the process and get your product in country. And then every country had its own little rules and kind of stuff going on in the EU, very similar to the United States. And then there came the thing is, but that didn't increase the 1% of the 1%. Because like as a doctor, you're going to put your name, reputation, and potential lawsuit on the line to write something when you don't know what's going to happen. You're going to take a company's product sheet and hope
You know what?
that, you,
That's a really good point.
yeah,
And not a lot of people have discussed that, because doctors do have to
no.
put their name on it, and it's literally every time they prescribe. It's
So if you look, is if people go back and they look at the patent that I filed, cannabis on the blockchain, which describes the seed to seed process. So we all know seed to sale. But
right,
what if I took up a unique identifier and I grabbed that, ingested into my Smart 8 blockchain, and then I put that onto somebody's handheld, onto our consumer-based device, right? And then they're wearing like an Apple Watch that was biometrically synced with this. So every time they ingested something, all the data from their heart rate, all the way their user experience got recorded against that graph. And then I fed that back against 300 or 500 all people doing the exact same treatment, and I came out with an average efficacy. And then I measured that over time and kept updating the system. Like, wow, like if you're a doctor, that's the closest thing you're going to get to a full-on scale. So our objective over the next 2 years is we're going to have 465,000 people, right, doing that with us. And it's not a big number. Like if you look at like companies like Leafly and all these other ones that have millions of them, that millions of people want to know.
right.
And, you know, we have a very strong acquisition program to go out and focus on the consumer. That's, I think, when I talk to investors, go, what's different between your launch in 2019 and what you're doing now? I go, well, look, retailers respond to the market demand, right? So we're going to create the market demand. We're going to go out, we're going to create our technologies. The biggest thing that we've done recently is working using a biometric component. Because, you know, people too much THC, they might kind of lie about some of the answers. So we're going to measure
Right.
their heart rate. We're going to gather all that, put that onto the blockchain, and then do the average efficacy. And we're going to reward that for them. And I'm happy to announce, like, we had a bit of a false step at the end of 2018, just because the regulators were about using coins for rewards, crypto-based stuff. So
Right.
we've got a regulator-approved model for a reward system. You know what? Works just like an Aeroplan. It's almost modeled off the Aeroplan basis. So you do stuff, we reward you, and then we pull the retailers through with that. And look, that data that we're aggregating is going over 2 years, and 465,000 people is punching out something like 7 billion data points. It's incredible.
Wow.
And that's just linear. That's not even the smart data. That's not even processed outcomes. That's linear. And so that's what we've done during COVID. And I know it's frustrating because we've been like, everybody's news hungry. I get it. I'm news hungry.
Right.
You know, as a shareholder. But what we've done is we focused on building that company, and those data points, and, you know, by getting those data points, by people wearing things and by buying them, and working with seed to sale companies by building our own API to our system. So you're like, offer this to your growers because they're already selling stuff, but they need to sell more. And then we get access to their customers, right? Funding growing companies, using our coin to help fund already established growing companies that are having that gap in funding, right? They need that extra 2 million by working with crowdfunding companies and being that cannabis section of it. What do we get access to? Well, we make revenue, but you know what we really make? We get access to their consumer. And so
Wow. This is
yeah, it's all about the consumer and what we're doing different. And there's some very good, smart technology companies. The ones have been around longer than us. What we're doing is we're focused. This is the tagline. And I think you, as being in this space.
and normally we ask, what's your differentiator? This is
it. Okay. We measure what's happening with a human being at a given point in time under a set of circumstances when using product A to treat symptom B. And we capture that point in time, and we capture everybody's, and then we process it using machine learning and advanced algorithms against hundreds of thousands of other people. So that when we say, if Brad has shoulder bursitis and he's used this in this milligram X amount of times, that over time the outcome will be this based on him being compared to everybody else. And what comes out of that is you get that end result of a clinical study when you know the formulation. And because we don't know the formulation, we're still getting to average efficacy. You see what I mean? We're solving the problem, but in a different way. And only with cannabis, because it's not a real medicine, can we do that. And what's really interesting, if I grab that information and attach it to all the growing information from a Graham Barrington, I now provide a regulator with enough information to make reasonable regulatory frameworks to allow for the importation and the use. So that's what we've done, and that's what we're working on in Europe. That's what we've been working on for 5 months, building those relationships and those inroads with those types of things. And the net end result is, like, we have so much demand for the data, for the user data. And so if anybody understands, or you're like, so how are you going to get it? It's simple. I'm going to give them, consumers, my own reward-based program. And then I'm going to go to retailers and say, hey, do you want to grow your business? Yes, I do. Well, if you reward this guy, if you take his stuff in and give him, you'll make a little bit less, but you'll capture all his cannabis spend.
All right, let's walk through it really slow. Let's walk through it really slow.
Sure.
I'm patient A.
Yeah.
I walk into a cannabis dispensary retailer,
yes.
and whatever, my like you said, my shoulder's hurting. I grab a product from the bud tender that they suggest. In that product is your identifier on that. I take it, it's linked to phone, watch, everything. The data points come back to you.
Yeah,
or do they go back to you?
So the way it goes, so first of all, and it's important for everybody to understand, this whole system's been built to an EU GDPR/HIPAA standard.
Right.
Okay, so information that comes from your usage experience, there's no tag to you as an individual. I care about big numbers, right? I don't need to know your name. I don't need to know this. So once it's in the blockchain, I think what's important to understand is, first and foremost, we're going to target the acquisition of 280,000 consumers on our own without the retailer. We're going to go find out. Yeah, yep. So we're going to spend an average cost of $15 a consumer to get them. That's a good chunk of money. And we're going to partner, and so one of the things, when you look at our recent deck that we're releasing, we're working with the crowdfunding company.
For those listening and watching, I have the deck. You should check it out.
Yes, thank you. For the crowdfunding companies and the reason we're partnering with cannabis crowdfunding, and we're also looking at seed to sales, is because they have consumers already. I want to lower my cost of acquisition. It's important that I take those 288, spend money getting them, because you got to remember, if somebody walks in, let's say, for example, you download the app and right away you earn €5 per se for doing that, you're gonna go, yeah, right on. And then you have a list of products, and you enter the products that you're using, and it'll start tracking. Now, the real question is, you got, let's say, 25 or 30 euros worth. What do you get to do with them? Now you go to the retailer, and the retailer's not using our system. And of course, we have our sales outreach to those retailers, say, hey, you know what? Right now, because the way it works in the United States and Canada, and it's a little bit different in Europe, people spend 30% of their money at one place. Our objective is to help a retailer grow that to 60%. Okay? So they get more. So, and here's the thing. For working with them, with bringing those products in, or using our product, which is just basically it's just an interface on their computer,
right,
that links with their supply system. By bringing in and redeeming those rewards, and then giving them like $20 worth of purple kush for shoulder bursitis and a certain milligram, or even an extract or an isolate, what will happen is that guy's all like, man, this is really worth my time. GCAC gave me points that the retailers redeem it. Now here's the cool thing. The retailer has those points. So what does he do? Like Aeroplan?
Right.
He gives them to a consumer that I don't target. They go over there, right? You fly with Air Canada. I don't necessarily use you're never going to earn enough points with Air Canada to actually buy an Air Canada ticket. But you can rent a car from Budget or stay at the Marriott, right?
I get it now.
Yeah, see? And you pass it along. And then he gets more sales from that. And the most important thing, and I think this is what sometimes when we talk about rewards, people miss. A lot of people use stuff like Fitbit and everything else. You know why? And they answer questions, and they get all synced up on this information. You know why? And they know Fitbit's getting that information because it's good for them. It's helping them. Nobody wants to get a prescription with cannabis and have a bad experience. So
Right.
why not tap yourself into a system so the next time you go see your retailer, what comes out of it, Barrington, is that guy can tell you, that's interesting. Maybe we need to tweak it. The system says to adjust it. So it's not Kentucky windage. That's where the algorithms come in. That's where the AI comes in. And those AI algorithms and stuff that were developed were by using inputs from some of the top doctors in Israel that were treating and practitioners in Canada too. One guy, Adolfo Gonzalez, had worked with 300,000 Canadians over 25 years, like through dispensaries. And he was the first set. And so what's going to be really interesting is, you'll start off, you've got 50 people all using the same thing. And it'll have an efficacy, could be high, could be low. Who knows? We don't know. That's the whole thing. Nobody knows, right? That's our answer that we're trying to find. But when it's 5,000, it could be 100% different. And that's the exciting thing. It gets smarter as it goes along. That's why I use it. And because it all gets stored on a blockchain, so people say, why the blockchain, Brad? And I go, first of all, it's a private blockchain. So why not just use a database? I go, because we need to show linkage, because once the AI gets in the middle and starts making determinations, you have to understand what the correlation to the decision was. And we're talking about tens of millions of data points, well, 6 billion data points. So if you're a regulator, you can look at it with confidence that the chain of custody.
There's transparency.
100%. And so when it comes, and this is what we're focused on, and I've said this before, we have people that work for us that have spent a lot of time working with the EU, pushing messages. I'm not going to call it lobbying, pushing messages, and that's one of our things. So we looked at the demands of regulators, and we worked the system backwards and how we built it, and that's where we've got. That's our prime. We're a data company. We're a medical cannabis efficacy database, and at the end of it, we're going to have 6+ billion, maybe more. I mean, I can never keep up with the way the mathematicians are doing it for me. And as we go along, we're selling that data. I can't tell you the amount of phone calls I get on a weekly basis saying we want to buy data. And you know who some of it are? Hedge funds. They want to know the efficacy of growing data so they can look at that and compare it to their own things and look about where they should be making investments. Practitioners, universities, other growing companies. Like it's. Can you imagine if we had a better data set before we went into COVID, how further along we would have been?
Let's not go down that rabbit hole.
Right.
Now let's go to the future.
Yes.
What is your exit? What are you thinking about?
Well, it's a 2-year plan. We're modeling everything as you saw after 2 years. It's about acquiring, going out, buying 288,000 consumers, turning those 465 through that kind of reward system upselling, aggregating all their data in, selling that data for a significant amount. Like some of the numbers are staggering. You can buy data points at 17 cents for a clinical type question answer, and you can sell for $1.20. And I know that because we've had those conversations with providers, right? And for people who want to buy it. And
I didn't know the breakdown of the cost like that.
Oh yeah. Well, so if anybody's really keen and wants to know and they want to sign an NDA, I'll be happy to send over the cash flow modeling, right? If you're a serious investor, right?
Right.
So it actually breaks it down. It's a huge look. It's a 70 to a 75% margin business. And here's the thing. When we talk about 17 cents and $1.20 out, that's a one-time sale. It doesn't mean there can't be multiple. But you never know how big it's going to be. You don't know if you're going to sell 10 times, 30 times, 40 times until it has net no value. The net exit out of this is a very cash-rich business. And I think when you saw that, like when you look at what you saw and the numbers and the margin, there's a lot of money in the till. And most importantly, that data with those patents, that's the exit. Like somebody, like if I was a pharmaceutical company, I would want somebody like GCAC to go do all the heavy lifting and go figure this issue out,
Absolutely.
and then swoop in with those incredibly endless deep pockets. Our job is to build the tech, and I consider that 465,000 users, and a lot of people don't know this, and so I'm happy to talk about it, is that taking the algorithm to the next level with the biometrics, by being able to take in our app and interconnecting with an Apple Watch app or Apple Watch or whatever the case is, whatever device we can connect to, it's huge. It lowers, because nobody wants a new watch. They want to work with the existing hardware they got. And
Right.
bringing those biometrics in, because your heart rate doesn't lie. So if you're hit something too hard and you're like, you're vibrating, well, we're going to measure that. And then we're going to correlate that. And then we're going to do that. And then what we're going to do is we're going to provide that to making growers make better products, regulators write better regulations, and doctors make informed decisions. And that in itself, plus the patent, that's the exit. What that looks like, who knows? But I'm going to have 6 billion plus process data points to make money off of up until then, and to hopefully somebody will come along and say, this is a methodology that will actually work.
And that is the note we are going to end this program on. Brad, thank you so much for taking the time. Thank you for your listing. We value you and your company greatly. Please continue to stay safe. And if you're watching, don't forget to, or listening, don't forget to subscribe to CSE_TV. You can check us out on Instagram, YouTube, Facebook, LinkedIn. And this interview will be broadcast on any of those various channels. This has been Barrington Miller, your host from the Canadian Securities Exchange with Global Cannabis Application Corp. Thank you.
Thank you.